Hey YouTube, it's Marida and welcome to another edition of the Nurse Lounge. In this edition, we are actually going to talk about something that was brought up on my TikTok, where she wasn't a follower or even a friend. She was just making a comment, but she wanted to complain about nurse educators and what we do and our students do in the clinical setting. She was a nurse who was expressing her annoyance, shall I say, with what we do on the floor. So I want to kind of take the time in this video right here to share exactly what it is that nurse educators or clinical instructors and nursing students are actually supposed to be doing in clinical comparatively to what the traditional nurse thinks. If you want to see what I have to say about this, then stay tuned. Welcome back. My name is Dr. Marida P. I'm a registered nurse. I've been a nurse for almost 17 years. OBGYN is my specialty. Well baby nursery. I'm a nurse educator and I am doctorally prepared and teaching at a HBCU. I am on break for the summer, so therefore I am not working as much. I do have a second job, but I will come to you with more videos this summer. So please definitely subscribe if you have not already. But this summer is going to be lit with videos, okay? Because I have nothing but time for the most part. And I wanted to kind of talk about a comment that was left on my TikTok. And basically, actually, I'll put the comment right here. So now that you've seen the comment, you see that she was just to give you the background behind the comment. The video that it was attached to was talking about representation matters and why it's important for students to see ethnic minority instructors, okay? And that's what the video was about. But she comes and leaves that particular comment, which wasn't even warranted for the video. But it was interesting because, you know what, it made me think about the fact that I don't really think that nurses on the floor even remember or even understand what we as nurse educators or clinical instructors have to do regarding our students. And so let me go first and just simply say that my primary job when I bring my students to the floor is not to take your vital signs, not to do your assessments, not to fill your water pitchers, and not to do your tasks for you. That is not what my role is or my students' role is on the floor. Now, with that being said, let me go ahead and put that out, put that out there. Do we do those things? Yes. But for some reason, when we come to the hospital, it's believed that here's a list of tasks for you to do. And once you get them all done, let us know. But otherwise, we don't be bothered with you. Because it's not uncommon for we to walk on the floor and the nurses to kind of turn their heads or sigh and huff and puff. Oh, we got nursing students, da 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 da. Now some nurses are very receptive. Oh, great, we have students. This is wonderful. They take it as an opportunity to teach or to have an understanding about what we do and want to be helpful. But majority of them are not like that. Majority of them see us and like kind of scatter like roaches. Like they're like, oh my gosh, we have students, and they just gone. All right. So I had to go ahead and set this one particular person straight on TikTok and help her understand that my job when I come to clinical is not, again, to do your vital signs and your task. So now I'm about to tell you in this video, what is it that exactly me as an educator is supposed to do? And what is it am I trying to achieve with my nursing student when we're in the clinical setting? So if this is what you want to hear, I'm letting you know what my job is as an instructor, as well as what I instruct my students to do and how I'm preparing them to be the nurses they're destined to become. All right. So with that being said, without further ado, let's go ahead and get into the discussion. First and foremost, As a nurse educator, my job is to basically bridge the gap between didactic, which is the coursework, the theory, the classroom, and the clinical setting. So as an example, if we were talking about, since I do OB, if we were talking about hemorrhage in the classroom, and I'm talking about the mechanisms of hemorrhage and what happens to the patient and what things we do to prevent hemorrhage, such as making sure that, for one, that we keep our patients bladder empty. Number two, that we do vigorous fundal massage when necessary when we see increased bleeding. Number three, that we do head to toe assessments, or at least a focused postpartum assessment on our patients at least every so often, every shift or whatever happens to be, depending on where they are in their post-delivery, postpartum recovery. That's kind of what I'm focused on. So we talked about it in class, I have the opportunity to show them some things in clinical. That's what I'm focused on. I'm not focused on necessarily your head to toe assessments, your vital signs, things like that. Now, will that help bring the whole picture together? Yes, it does. I also, for me personally, this is just me. This is me. My job, again, is to bridge the gap, like I just said. Now, how do I do that? I bring the students to the hospital. I have a list of things that I want them to accomplish based off of not only what they're learning in school, but number two, what the School of Nursing requires them to do, which may not be in alignment with what the hospital needs are. So when people make comments that, oh, well, they're not helpful, they're not doing this, they're doing paperwork, that's what they're supposed to do, because that's what we are grading them on, because that's what we're evaluating them on so they can pass clinical. Be mindful of that. Number two, when it comes to my students specifically, when I want them to take care of a postpartum patient, I want them to be able to go in and not only take care of that patient in terms of doing their bubble he assessment that we have, the postpartum focus assessment. I want them to do that. I want them to know how to have people skills, interpersonal skills. I want them to be able to critically think. I want them to make clinical judgments, sound clinical judgments. I want them to know the rationale as to why they're doing things. I want them to pass meds in a timely manner. I do want them to do vital signs so they can see how the whole component fits together. And I, of course, want them to do the head to toe assessment, yet again, to see how the whole component fits together. Now, my objectives for my students are not the same objectives that the hospital has for the patients, in the sense of how a nurse would care for that patient, because I am teaching them how to be nurses. While I'm doing so and teaching them how to be nurses, I'm also focused on where their thought process is. How do they think when it comes to caring for these patients? Keep in mind, they got to take the NCLEX, right? So taking the NCLEX requires them to be able to say, okay, you know what? How do I think? How does my student think when it comes to caring for a postpartum patient? Does he or she think about the fact that they're tired because they just had a baby? Do they think about the fact that what do these medications do to the body? Do they think about the fact that if they have already tired and I give them narcotics, what could happen to them? If they think about the fact that these people can have high blood pressure, do they actually understand the psychosocial dynamic? Do they understand what homeless women go through? Do they understand what abused women go through? What about postpartum depression? That's mental health, right? We have to bring all of that into the whole conglomerate of what goes on with caring for a patient in the OB spectrum. Speaking OB again, because that's what I do. So when I bring my students, now I'm not speaking for all instructors, because we all don't do things the same, because every program actually is different and has their own guidelines as to what they want their students to do and not do. It also depends on the level of student that we're talking about. So if we have a student who is first semester taking fundamentals, I'm not focused on them doing no head to toe assessment per se. I want to know, can they make a bed? Can they do a bed bath? Can they do vital signs? That's where they are in their training at that point in time. Now, by the time I get students, because keep in mind, OB is considered to be a specialty area, and typically your specialty areas are done in your senior year. Typically, not all schools, but most schools do specialties their senior year. With that being said, if it's done in your senior year, I have an expectation that you already know, the student already knows how to do a head to toe assessment. I just need to fine tune it for OB specifically. So yes, when they come to my floor, to my unit, or to my rotation, shall I say, I am expecting them to know how to do vital signs, how to do a head to toe assessment, how to pass meds, how to fill the water pitcher, how to do all these things. Now, the problem is a lot of my students have not been able to put the whole thing together. Meaning, in one rotation, all they did was make beds and do bed baths. And the next rotation, they got to pass 2 meds, and that was it, the entire rotation. And the next rotation, they passed 2 meds and they maybe did a set of vital signs on 1 patient. On the next one, they may have did part of an assessment on a patient, a focused assessment at that. When do they get to put the whole thing together? For me, that's what I focus on, putting the whole thing together. So we walk in, I get my patients that we're going to have for today, for that day. I then tell my patient or my students which patients they're going to have. And I say, we're going to put this whole picture together for you so you can understand what it really is to work as a nurse, not where you're doing bits and pieces. For my students, they love, well, they hate it because they're scared to death because they never had to do it before. But then they end up loving it because of the fact like, wow, I feel like I'm a real nurse, because you are functioning as a real nurse to a certain degree. So when it comes to my students come in and do what I just said they do. They walk into the patient's room. They introduce themselves, put their names on the whiteboard. They do vital signs. They do their assessments. They pass meds with my assistants. They hang IV medications with my assistants. They do a full head to toe assessment with my assistants. They then come back and document or chart, as you will. Now, it may not be that they chart the whole head to toe assessment. They may not chart everything, but they get snippets of everything that we have to do to take care of our patient. Because I work in OB, we give Tdap vaccines, we give, what else? MMRs, we give, different things that we give. So I teach them that, and they learn how to put the whole picture together so they can better learn how to organize their day. That's what I teach my students. So that may or may not align with what a actual work day goes for actual nurse. So again, my job is not to make sure that you done passed all your meds. My job is not to make sure as the nurse that you have to get all your assessments, that all your water pictures are filled. That is not my job as a nurse educator or a clinical instructor. My job is to do exactly what I said to do, in which I'm going to make sure that my student knows what goes into being this particular kind of nurse, which means they're going to get a snippet of it. Then at the end of the day, or at some point when they have a break, we're actually going to talk about our nursing diagnosis. Yes, we still do those. Nursing diagnosis and care plans. We still do those. That's part of our clinical day. So I cut my day off early so that we can focus on the paperwork while they're still in clinical, still in the environment. So we can ask questions. We can go look at the charts. We can go do different things like that so they can get their information. That's kind of how I govern my day with my students. So I said all that to say, I'm not an instructor who sits there and drops her students off at the nurse's station, say, be back, at 2:30 this afternoon and see you later. No, I don't do that. I'm actually a hands-on instructor where I'm with my instructor or with my students all day long. And I'm working with my students all day long. Because guess who has to evaluate them? Guess who has to give them the grade? It's me. I don't partner my students up with nurses. That's just me. I don't put them with nurses. A lot of nurses do that. A lot of nursing instructors do that. They will put the student with a nurse and let them do what they do the entire day. I don't do that because, for one, nurses take shortcuts. And I don't need my students seeing shortcuts when they will devise their own shortcut to a shortcut. I need to know that they know how to do it right, the correct way. And when they get out there, they'll devise their own shortcut. That's just kind of how we are as nurses. We all take shortcuts. That's understandable. My thing is, though, when we take those shortcuts, where is it coming from? Is it coming from a place of that I saw my instructor do it, so therefore it is the right way? So when I make my shortcut, I'm making my shortcut from something right? Or am I making my shortcut from something I saw that was totally wrong to begin with? I don't want that impression in my students' brain. I want them to come out knowing the correct way, and then after that, they can devise their own shortcuts from there. So I wanted to come and kind of tell you all, for one, if you're a student, how I do things differently. Number two, if you are just not just a nurse, but if you're a nurse on the floor, that our objectives for our students are not the same as your objectives for your patients. Meaning that we're not coming there to shadow you, to do your task work, to, oh, go pull that Foley. We found a Foley you can go pull. You want to go pull that? Well, of course, that's a great idea for them to do, but if that's not my focus for the day, then that's not what we're doing. That's kind of what I'm saying. My students actually get their own patients up. They pull catheters out. They take IVs out. I have my students, by the time they finish my rotation, they thinking they ready to go work by themselves. And because of the fact that I've kind of pushed that into them, that this is what you're going to be doing as a nurse. Now, of course, do you think that everybody wants to be an OB nurse? Of course not. However, the principles that I teach them in the OB rotation will go with them no matter where they go into nursing. So if they're going to be a bedside nurse somewhere, they still have to know certain things. The things that I focus on is not what the nurses focus on. So what am I focusing on with my students besides what I just told you? Assessments, meds, vitals, things like that. I'm focusing on these other elements as well. Time management. These students have never had more than sometimes 1 or 2 patients. I give them 2 patients, sometimes 3 patients a piece. Is that hard on me? Yes, it is. But they need to feel what it's like to have 2 to 3 patients, because why? When they get in the real world, they're going to have about 5, 6, 7 patients. So I want them to kind of know what that feels like. I want them to feel like, ooh, I feel like I got so much I got to do. Yes, you do, because you have 2 to 3 patients. So time management is important. Prioritization. Sometimes my students get caught up in charting and they forget to go reassess the patient's pain that we did an hour ago. I have to remind them that is not important. Charting is not important. Go take care of your patient first. I have to remind them of those things. So time management, prioritization, self-directed learning. These students are not self-directed. What does that mean? That means instead of asking me, what is a SVD, which is spontaneous vaginal delivery, that means you need to go look it up. When you go look something up on your own, you will remember it a whole lot longer than you will when you ask me. Here's the example that I typically give my students. When I go to a new unit, right? And of course, you know, all the doors have codes and stuff on them. So I'll say to a nurse, what's the code on this door? And she says, let's just say it's 1, 2, 3, 4. So I'll put 1, 2, 3, 4, beep, the thing opens, I go in there, do what I need to do and come on out. Okay. Well, guess what? I come back around again. Like, dang, what is the code to this door? What's the code to this door? 1, 2, 3, 4. Okay. 1, 2, 3, 4. Okay, go again. Come back next week. Guess what? What's the code to this door? I have not committed it to memory. I have not written it down. I haven't did anything for me to have to work to make sure I remember what that code is to that door, besides ask another nurse. No, be self-directed. So either I go look it up, I take the time to write it down, I do something that's going to make it commit to memory, because that is how I'm going to learn. It's by committing it to memory. Be self-directed. So if you're a nursing student, be self-directed. Go look up stuff on your own. Now, if it's an emergency, you ain't got time, you ain't got time. But if you do, come to either clinicals prepared, number 1. Number 2, go look it up on your own. Be self-directed. It's called self-directed learning. That's what I require from my students. Don't come asking me nothing that you should already know or that you can look up on your own. Go look it up. The next thing I want them to do is be organized. You know what organization means. Simply have your stuff together. Now, I will say this. When you first go into a patient's room, it's not going to be too many times as you go in there back and forth, 3 and 4 or 5 times when you realize, you know what, I need to get my stuff together. Once that patient look at you crazy, you're going to be able to think then, you know what, I need to get my stuff together. So they will learn that kind of on their own, organization. So we talked about prioritization, time management, self-directed, and being organized. My last thing I always like to make sure that my students know how to do is critically think, or at least we work on critical thinking skills. Critical thinking skills are imperative to be a nurse, period. I don't want to say registered nurse, to be a nurse, period. If you cannot critically think, you will not be successful in nursing, period. You have to be able to think beyond the situation at hand. If I do this, then what will happen? If I don't do this, then what will happen? You have to be able to think like that as a nurse, because if you can't think like that as a nurse, then you can potentially cause a sentinel event, cause harm, cause somebody to die, and you don't want that on you. So this was basically what I wanted to kind of explain. What is my role as a nurse educator in the clinical setting, and what is it that I expect my students to do? I'm talking about me and my students, so don't come on here, well, all educators, I already know that. I've been an educator at different facilities for over 15, 16 years. I know what educators do at different facilities. I'm letting you know how I take care of my students. With that being said, you understand that nursing is an art and a science. The science behind it is the rationale, is the evidence-based practice as to why we do what we do. The art behind it is why I do the way I do it, how I teach my students to do certain things. That is the art behind being a nurse, because we can teach them a certain way. We can make sure that they're a kinesthetic learner, they're a hands-on learner. Let me go make sure they can touch it. So like, for instance, at my last clinical, maybe a month ago now, we were talking about the placenta. Well, somebody had a baby and the nurse happened to say, hey, do you want to see the placenta? I'm like, yes. So we got that placenta. We put our gloves on, and I'll start playing, showing them the shiny Schultz and the dirty dunk inside. And luckily the actual sac was still attached. So I showed them what the sac looked like attached to the placenta and everything. And they got to see it. And actually I let them touch it and everything. The placenta had just came out, of course, the mom. So guess what? It was still warm. They got to see that this was an organ. This is something that actually took care of the baby. It was a lifeline for the baby. They got to feel it. And they were like, oh my gosh, I got to feel a placenta. You know, it's nothing that you per se want to just like write home about. But the thing is, it was exciting for them. That was an experience for them that somebody else may not have been able to give them. So with that being said, I love being an educator. I love doing what I do because of the fact that it's how I teach them is what makes them know, not necessarily what I teach them, it's how I do it, how I bring the whole thing together for them. And so I'm saying that to say that if anybody who happens to be a nurse who's watching this video and you're like, every time they come to the floor, they doing this, that, and the other, whatever, before you accuse the instructor of not doing his or her job, first, find out what is it that they're supposed to do. Number two, what are they allowed to do? Because there's some things that either the hospital won't allow them to do or the School of Nursing won't allow them to do. Or sometimes the clinical instructor has been thrown into a situation where they won't allow them to do it because they have never done it themselves. We are there to educate. We're not there to wing it on our own when we have never done it before. Do you see what I'm saying? So with that being said, sometimes we're not doing something not because we don't want to or because we're lazy, because our school does not allow us to do it as a student. There's a liability with that issue. So if we do something and get caught doing it and something happens, there's a liability with that. I have worked at schools where students can't even do blood sugars, where I've worked at another school where students could do blood sugars, hang IVs, do all kinds of stuff. Some schools, it just depends on the program itself. So before you all as nurses generally say, well, these students come in here, they can't do nothing. It just depends on all those issues. Where are they at in their rotation? Are they first semester students? Are they senior students? Are they about to graduate? Are they doing a preceptorship with you? What is going on with these students? Usually the higher advanced they are, nursing student, the more they're typically able to do. Not always, but a lot of times that is the situation. Also, the level of the student. Are these LPN students? Are these RN students? Are these NP students? What kind of student is it? Because that will also let you know what they can and cannot do. It has to be within the scope of the practice of that kind of nurse. So be mindful of all those things. It's not just cut and dry like you all may think it is. So with that being said, I wanted to come and kind of dispel some of that, because some of people think, these students come in here and they don't do nothing, on. Well, that's why. Okay, that's why. All right, so thank you for watching this video. As usual, follow me on IG for one. Number two, follow me on TikTok. You're on TikTok, and that's where I get a lot of my matter of fact, this one right here came up because somebody's Karen's comments, and I get inspiration from that, actually. So the negativity actually breeds positivity, because I'm able to share with you different things that I've never thought about before. So that's where that came from, was from TikTok. So follow me over there as well. And if you happen to have questions that you want answered here on a Q&A, either here or I'll do a video for you, a quick video over there for you on TikTok, definitely comment that below, or just go over there to TikTok and ask the question over there. I do have a Q&A section on my profile, but definitely do so. I want you to like, comment, share, subscribe, do all those different things. Whatever the jargon is for this, do all that. And until the next time, you all take care. Bye-bye.